we've always had reams of records of families, writing things down, replicating the writing, and this, having something that we can use which is mobile, fits so well into that.
In between my visits, I can sit in the car and I can type up my actual visit on my electronic diary, which then speaks to my desktop, and then I can copy and paste the information over onto Clinical Portal, which definitely saves time, because otherwise I would possibly be popping back and forth to the office to type up these notes, which means then I can book my visits a little bit closer together, and ultimately then see more and more families during the day.
I used to book out a day a week to catch up on report writing, and by dictating my reports, I freed up that time to see more patients. So I have an extra day a week to see patients, which as a clinician we all want to see more patients, so it's a win-win.
And the mobilisation team have been really helpful in developing the Clinical Portal app. So now we're able to download information on families, and we can go into their homes. We've got that information there. We can write up the records. We can make referrals there and then on the spot.
Another big benefit of having an iPad is we can do datex directly from an app on the iPad. So you can do it there and then in the patient's house if you feel comfortable, or sitting in the car when you go outside. Often when I go back to the office, I'm distracted by lots of questions from the team, different phone calls, and you spend a lot of time then sort of wasting before you can do the datex. So with being able to do it on the iPad, it's really beneficial.
I find the iPad really useful, using it on a daily basis. Probably the most common thing is taking photos. So that could be communicating wound information to other members of the team, the fit of an orthosis or surgical footwear.
So as a junior doctor, often very pressed for time and juggling lots of different jobs all at once. And mobile working gives me much more information at my fingertips, and helps me be much more efficient. So, for example, if we've got a very sick patient that's septic, and I need to give them some antibiotics, but their kidney function isn't very good, or they've got lots of allergies, I can access the local hospital guidelines from the app in my pocket. So I don't need to leave my patient, find a computer, log in. I've got the information there, and I can get that antibiotic prescribed quickly, which is the most important thing with sepsis.